So here's a knee immobilizer. These can be found in our 312 room. However, a lot of doctors will have the patient come straight from the hospital with the blue and white ones, but they both try to prevent the same thing. They're trying to keep the knee immobilized in a straight position. So this one, it is a black, soft, cushiony foam one. When you open it up, you can see that in the middle here, there's these hard bars, and that is designed to go behind the patient's leg, behind their knee, because what will happen is it'll prevent them from bending their knee, whether it be an injury in their kneecap, and if they bend it, it'll add stress. Whatever the case may be, the bar will help prevent that, as well as the immobilization from the straps in the foam. So when you put it on a patient, it's going to be easier to put it on in bed because their leg is straight. You can have someone help lift the leg to get it nice and high. I'm showing you in the chair. More than likely you want to put it on in bed. If it needs to be adjusted in the chair, it's good to have a leg rest, but I'm just showing you just for demonstration purposes in the chair. So this one, you'll see that it's kind of in a cone shape. There's a wider part up here, the narrow, or kind of a narrow part down here. The wider part goes up towards the thigh because that's the larger circumference. So you want to make sure that the bar goes in the behind the leg, and then you overlap the material. Now this one does not have the hole where the kneecap comes out from. So, but with those, you want to make sure that's where the kneecap is for the patient. And sometimes you'll have to pull it up pretty high. You might have to have the patient move their leg out to really get up in there. But this should be put on in bed. Same thing with any immobilizing brace or any brace or splint. You want to check the skin integrity before you put it on and after you take it off. So with this one, there's some alternating Velcro straps. You want to put it on nice and snug because if it's not snug, it'll ride up and down, especially when they're transferring. So you're going to put this on tight. Now maybe where they have incisions, you might not be able to get it too tight, and that's okay. You want it to be within patient tolerance. And like any strap and anything that's going to be on a patient's skin, you can do the 2-finger test. Make sure you can fit a couple fingers under there comfortably. If you can't, it's too tight. If you can fit more than 2, it's too loose. So here it's nice and snug. If I try to bend it, it would take a lot of force to bend it, but you want to make sure that's on. And the instructions for wearing it are going to be on the board. Usually most of the time it's at all times, except for hygiene. So that's your knee immobilizer.